Okay, I think I'd like to kickstart. Thank you very much for joining us. It's great to be speaking with people over this webinar and sharing with you some work we've been doing around the RIX Wikis and our multimedia advocacy project that we've been running at RIX for many years now. So I'm going to kick off with a few slides just giving some background. I'm Andy Minion and I am in charge of RIX Research and Media here at the University of East London. For over 15 years we've been working around research and development, particularly looking at ways in which new media technologies can really benefit people who have a learning disability. That's extended to anybody who has special educational needs, and in particular in the context of the SEND reforms, we've had a very strong focus around young people, but that does extend to people of all ages. We call our approach a living lab approach because we work direct with people with a learning disability. Our focus is what we call the learning disability community. And our approach we call multimedia advocacy, and the key tool for this approach is the RIX Wiki. So it's the RIX Wikis that are very much the subject of the first part of our session today, because we've had that software and the training and support that goes with it in use across a large community of practice in the UK now for several years, and we were conscious that it was high time for us to do a more comprehensive evaluation of how people are getting on with those RIX Wikis. How closely are they matching the needs and the demands that are made around the SEND reforms? Our evaluation is still in process. We've got some of those who are expected to contribute are still completing their questionnaires, but we are expecting to publish our report in the new year as part of a new drive and a new opening up of opportunity for local authorities, for schools, and for NHS and other education partners to come in and work with us further on implementing RIX Wikis and the multimedia advocacy approach. I'm just going to go through 4 slides which capture the initial findings we've had from. There's been 10 local authorities contributing to our findings, along with 4 or 5 schools, FE colleges, and other community-based services, including large provider organisations. And the data that's come in has been encouraging. It's highlighted some challenges, but above all, it's highlighted some real results, if you like, some genuine impacts from the use of RIX Wikis. Over the years we've been very tuned into that. We have these community events where people who have bought into RIX Wikis come and share experience. And we produced over 40 case studies of RIX Wikis in use, telling fantastic stories about benefits for families, for individuals, for young people in particular, and also at organisational level, really encouraging ways in which the use of this software and this way of working has improved delivery of services. At the same time, we needed to do a bit more of a systematic gathering of evidence. A lot of the people we were talking about who were wavering on whether to take the plunge and get involved in working in this way felt that they needed some further evidence to demonstrate the business case for RIX Wiki use. So here are our findings so far. I'm going to start with on communication. Clearly it's a media tool. The RIX Wiki has really done its job in terms of being a hub that helps improve communication around all of those stakeholders involved in SEN and disability implementation. Critically, the relationship between families and providers of services and the professionals on the front line has been visibly and improved, and that's been reported across the piece from all of those who we've surveyed as part of evaluation. Additionally, we've seen connection between professionals be genuinely improved. That's been really useful because so often it's the parent or the family that has a view of 2 or 3 different setups that are contributing to the support for the individual they represent. But the working communication between those bodies falls short. And Wikis have provided a genuinely person-centred way of helping glue those professionals and their working practices together, rallying, if you like, round the individual and the family, which is exactly what the SEND reform's supposed to be all about, after all. That third bullet point there relates specifically to why we've invited Richard Lawn here from Camden Council to join us, because he's really pioneered the use of our RIX Wiki systems to improve the accessibility of information, particularly around the local offer in the council area where he works. And he's going to talk about that further. We've got that down as a finding because we were very impressed to see that a significant proportion of the local authorities were reporting real benefits around making local offer information more accessible and easy to understand for people. At the heart of the RIX Centre and our work is the pursuit of self-advocacy, helping people with disabilities, people who experience special educational needs, helping them to self-advocate, helping them to have a voice and making sure that that voice is heard. As we know, the critical part of self-advocacy is often the role of the advocate, the family, the parents, the carers. So it's both the children, the young people and the parents and carers that self-advocacy needs to improve, around which self-advocacy needs to improve. If we're going to genuinely achieve a sort of person-centred model of providing services that we're after. Our findings, all of our participants reported improvements and enhancements in the capture and the sharing of young people and children's voices in the process and those of their families. And that is the key finding, I think, around this. It's obviously our intent, but we've been really reassured and pleased to note how consistent that has been achieved. And on all sides, there's been a report back that this has had strong knock-on effects in terms of improving the relationships involved around negotiating education, health and care planning, around putting support plans and processes together, and around then monitoring outcomes and making sure that the goals that are identified around individuals, around young people and children, are genuinely achieved. That's had a great effect, we've noted, around young people, particularly highlighted in the schools that we canvassed. The wikis and the creation of individuals' person-centred plans by children and young people in those schools have become a focus, not just for organising those individuals' thinking about what they want, considering their choices, reflecting on their strengths, reflecting on their futures and their goals. It's also proved to be a really valuable tool around which to rehearse having a voice, speaking up about yourself, talking about what your hopes and dreams are. And that's led to the use of wikis systematically in review meetings, and which means that the young person themselves is then able, with the assistance of self-produced wiki, has been able to self-advocate, to speak up for themselves, effectively to start not just contributing to their meeting, but effectively chairing it by putting their voice to the fore. And that's been a very powerful force, and the schools have all reported that it's shown some real improvement in the confidence in the self-expression of individuals with special education needs and disabilities. A critical point that everyone's looking for, of course, in this climate is evidence that the RIX Wikis and the multimedia advocacy approach genuinely achieves its promise of making savings, of reducing costs. There's an investment involved in bringing RIX Wikis in. There's an investment in training, and there's a small investment in the software subscription involved. It needs time, and it needs everybody involved to take on new practices, new ways of working. Naturally, those commissioning RIX Wikis from local authorities, from schools, from care organisations want to see evidence that that has a return, that once people are up and running with RIX Wikis, that savings start to accrue, that there's genuine evidence of improvement in the quality of service and reduction in the cost of service. These 4 areas highlighted here have been where people have reported those savings. And the first one can't be understated. By improving the relationship between the local authority mostly and the families, but also between home and school in those local situations, we've seen a really substantive improvement in the quality of the rapport, if you like, with families. That means less recourse to tribunals or to disputes, which are so often what local authorities end up firefighting in the place of pursuing good quality services. And so this has been a strong improvement in the quality of provision and that relationship, and with it, a reduction in cost. Managers are less wrapped up in those adversarial relationships, and so they're giving their full attention to the delivery and the quality of a person-centred provision. The improvement in terms of the exchange of information has been noted across the piece, and that's because with the voice of the family more clearly heard, actually there's, as well as reducing that adversarial relationship, the actual quality of the data is more up-to-date and it's more clear, right down to the spelling of people's names and of their the individuals. Those small details can cause real expense in data systems. So we've had reports of significant evidence of costs being reduced there. And similarly around administration, because the wiki is an online system, it works comfortably and readily. It's in the place often of meetings, the need for repetitive meetings, and in the place of having to chase people with phone calls and bring people together. So we've started to see, and this has been reported systematically across the board, we've seen services working more effectively together, and therefore the administration costs being reduced. Less meetings, less phone calls, and less paper communication. And lastly, our findings do include, of course, we've invited people to share with us the challenges they've experienced. And, we're pleased to say there's a lot of optimism and positivity from across the board, but people have reported challenges around taking up this new way of working, around the training required and the focus of attention, just to get people on board with the use of the wikis and the new practices involved. It's with our longest clients that there is true confidence that that investment up front in terms of getting people trained and the change of practice, the change of culture, if you like, that's involved in taking up these new way of working, that yields results. So we're very pleased to report that the longer people have been involved in RIX Wiki implementation at local authority level, the clearer the benefits and the clear return on that initial investment. That's my swift summary. You are going to be the first people to receive copies of the detailed report, where we go in to much more of the ins and outs of those evaluations that have come back. I'm going to move back, though, to that perhaps a slightly unexpected emphasis that people have made around the use of wikis for information. And I'm going to put up on screen here a snapshot of a screen at the Camden local offer, where if you pursue the link to Camden Click Start, it's called, isn't it?
Well, I've changed it to just Camden's Wikis.
Camden's Wikis,
yeah.
Thank you. And Camden's Wikis have been used. How many of these have you produced?
In that portal, there's 21 what I would call public service wikis, full of useful information in an easy read format, 21 of them.
Right. And I'm going to just show this other slide. This is how they sit in your local offer, is it?
Yes, that was a real result, finding out that all we had to do was request a template from Open Objects, who are the people behind our local offer website,
yeah.
And it was we just had to put in the URL of the wiki, and it could sit actually on the page, without taking you away from the site. And because we had so much feedback from parents and young people, particularly young people themselves, when we were developing the local offer website, saying, oh, there's so many words, there's not enough pictures, everything's too small, and can we have this, can we have that? You're actually quite limited by the software you're using, by the platform you're using, so Open Objects in our case. But seeing as the work had already been done, because I'd already made the wikis, it was a real revelation that we could just embed the wikis in the page. So this is the preparing for adulthood part of the local offer website.
Right, yeah.
And the first page you go to, it's flagging up really clearly, look, we've got easy read information, we've got wikis, and they're very practical wikis. So it's not the slightly drier ones about what's a personal budget or what is safeguarding, which obviously we have as well, but more like, where can I actually go to do some sport and exercise? Where can I go to find some activities for younger people within the borough? Because a lot of that adversarial situation that we found ourselves in the area of transition was around what can our young people, our children do, and where is that thing, and why can't we easily find out about what they can do? So this was our solution to that, really.
Excellent. I see your wikis cover all sorts of topics like personal budgets and safeguarding, etc. Alongside an account of what's going on locally. What's been most popular with users?
Well, when we've collected data around that, the activities for young people and the sport and exercise wikis, and recently the college wiki that I've just made, what's the further education provision for these people in borough, have many, many more hits than the sort of slightly more formal what's a personal budget wiki. They've all been quite popular, but the ones where it's actually giving people real information about real-time activities, what they cost, where they are, but all in an easy-read format, those have been much, much more popular. Right. Because that's what people are looking for often when they go to their local offer website. Yeah. What are the activities that we can get involved in, beyond school or college?
So just to be clear, this set of wikis sits in parallel with the local offer and links across to it.
Yeah.
And you've produced them yourself. Clearly, other people local people being involved as well.
Yeah, absolutely.
And you've used photo symbols, I see there.
Yeah, I've been using photo symbols for about 10 years now, since they first started, and photo symbols just seem to tick all the boxes that you're looking for when you're looking to symbolise your information. They're in colour, they're photorealistic, they're cut out so there's no distracting information, so they're different from photos. Yeah. And they work really well, and we've obviously, in the early days, we did a lot of consultation around them to check that they work really well. and people really like them. They work really well, and of course you can make your own as well. So if you can't find that very local image you're trying to find, you can actually quite easily make your own photo symbol. So yeah, that's a very much a photo symbol look there.
Yeah.
And as you go into each wiki, many of the slides will have a photo symbol on.
Yeah, and just to be clear, Photo Symbols are a company, a not-for-profit company that work with people with learning disabilities employees and create a whole rich set of symbols, and many local authorities subscribe to them, don't they?
Yes, and health trusts and people like that, all sorts of people. And the great thing for us is, of course, they've started doing some of their photo shoots in Camden, so we actually have Camden residents in there as well, which is great for us.
Okay, another thing about Camden, Richard has shared that the borough is more than happy to share some of the wiki content that's been produced as a template that other local authorities might wish to take up and add their own local information.
I think that's really key, and I think since I've been doing this work, so I've been the Accessible Information Officer for about 14 years now, I've always wanted to share for free anything I've created, because what's the point in hundreds of different local authorities making the same information? Because safeguarding doesn't change whether you're in Manchester or Camden, and it's the same with a lot of these areas. So for me, all it would take is to unbrand it, and then for people to put in their own phone numbers and their own logos, and I'm happy to share that. With at no cost from Camden anyway.
That's very exciting, and just to add to that, we've produced, haven't we, with you, some learning and guidance materials on video where you explain how you work with people to create these wikis and ways of producing photo symbols, etc.
Yeah, so the last wiki on this, so you can't see it here because it's number 21, it's actually called My Wiki Website, and it's the kind of thing that you've also produced in RIX, but just with my own spin on it, using photo symbols and really focusing on that person-centered use of a wiki, which of course these aren't. These are what I would call service wikis, but also there's that whole other way of working where you give an individual or a family a wiki, and that My Wiki Website wiki talks a lot about the principles of person-centered planning, of person-centered thinking, and how you can use this platform to really empower a person and create a very powerful support tool which saves lots of kind of reading of guidelines and sort of, read this from the speech therapist, read that from the OT. Actually, you could just look at this wiki. Or this tells you how you could create this wiki.
So Camden, they're using both the informational, easy-to-read qualities of wikis alongside the person-centered planning tool that the wiki tool can provide.
Absolutely, and actually in a third way as well, which is with my colleagues. They're using wikis for training, so they might put a wiki together about dysphagia, say, the speech therapist, or they might put a wiki together for a resident, which might be the physio guidelines for, let me just video you doing that exercise so you never forget how you do it, and then we'll put it on your wiki, and then whenever you forget how to do that stretchy thing, look at your wiki. So it's limitless possibilities, really.
Okay, well, look, thank you very much for giving us that snapshot, Richard. I'd like us to connect with our audience here and just invite people to come in with questions, etc. For that to work, I'm going on to my screen here to allow audience unmute, which I've done, and I'd like to invite people who are listening to come up with any question by first unmuting your local system. We've had a question come through that's particularly focused on parents and parent carer forums. We found that where local authorities have taken up RIX Wikis, one of the channels through which that's been really hastened and made more effective has been through involving parent parent-carer forums. And it's been interesting to see how with some local authorities, it's the work closely with local champion parents that's really helped bring this new approach to life, with those parents standing up, sharing their examples, sharing their experiences, and being the drivers, if you like, for the adoption of RIX Wikis. In other local authorities, the drive has come more from services, particularly speech and language, occupational therapy, and physiotherapy. And in other local authorities, this has been driven with uptake from schools. In each case, the tentacles go out and others get drawn in, but it's those different directions of or different ways in which local authorities choose to introduce wikis and build take-up and recruitment that's been really interesting to see. What's been strongest in Camden with take-up? Has that come from parents or is it school adoption?
Well, we started off with parents, so I did a pilot with I think 8 or 9 parents who were part of the Parents Forum, and then we rolled it out to schools. So obviously with the first tranche of parents, each of their, they each have a child who's got a SEN, and they each had a wiki, and then I rolled it out to schools. Of course it becomes, there's a lot of schools in Camden, there's a lot of pupils, there's a lot of SEN pupils, so we've given free wikis through our subscription to each of the SEN coordinators, who then said, well, we've got 7 children in this school, we've got 8 children in this school. So they all have wikis, and they're all at various stages. So some of them are really hit the ground running, others are struggling to find the time but are really keen on it. But we've had very positive feedback about the potential. It's all about finding the time. And of course, the more you use the software, the more you realise actually you can put a wiki together very quickly, but you do need to do that first bit of exploration as to how can I work with this,
Yes.
So currently I think schools probably the biggest uptake numerically, and sometimes through parents and sometimes through the Senko. It all depends what the family wants. Some families don't, they say, yeah, that's a great idea, but I don't want it. I don't want it, it's too complicated. So the teacher will say, well, I'll hold it for you and I'll share it with you, and you can share the password, and they just come to an agreement about it.
Yes.
So there's a lot of potential around schools, I think.
Thank you. And we've had with some of our schools, the uptake has led, use of wikis has led to very positive mention in Ofsted reports. Above all, it's given a real framework around which to bring in the school's additional responsibilities for person-centred planning, bringing in new agendas, new ways of working that are less about highlighting people's achievements educationally, and more about their aspirations and the outputs that they're after. Right, we've had. I'm waiting to hear from our audience if they have any questions. Please do use the. I'm sorry, I do have Laura. Thank you. How do you manage the training and implementation from a council perspective, e.g., time with training, etc.? Okay. Well, the way that's worked, when you buy the wiki packages from us, you get a bundle that includes a number of accounts, which could vary from 50 up to more than 1,000 in some cases, depending on the level in which you're intending to implement. And alongside those wiki accounts comes a whole program of training provision that's balanced between online training and face-to-face. We've found that what works best is a blend of the two, because people like to be able to go online and just snag through any challenges they might have with remembering how the wiki system works. In principle, actually, people often say, I want an instruction manual. We provide one, a very easy to read one, of course, but actually they don't need it because it's quite self-explanatory. So it's not the technical challenges that the training has to focus on. It's the whole strategy for implementation. It's how we go about getting wikis adopted, establishing some early users, adopters who are prepared to share their experiences and pass on some of their skills and insights, and then going to scale either through schools or through parent and carer forums or through services and through with public events. So we provide in our package, there will typically be half a dozen different on-the-ground sessions that we bespoke with the local authority with particular targets in mind. Let's speak to parents next week. Let's showcase examples, good examples of wiki use with parents, but also let's offer parents training that brings them together at a time of day that suits, followed up with webinars or online Q&A sessions, followed up with the online training that's on offer. There's a whole pathway of online training that comes with wikis that can take you, that can help you become a wiki coordinator as well as a wiki creator. So it's that bundle of wikis with training that's so critical to the RIX offer, and that's part of our, if you like, university positioning that helps us to do that in a very rich way. The essence, though, is that we work really closely with the local authorities to put that package together, and as part of it, as we move through, we also work strategically with the local authority to help put together a business case for continuity and for sustaining and growing the adoption of multimedia advocacy across the local authority. So thanks for that question. I'm noticing the time, and I'm noticing that actually that's the end. That's the end of our half-hour slot for the webinar. I'd like to thank you. It's great to see so many people attending the session. The discussion we've just had has been recorded along with the slides, and that will be shared online through the RIX Wiki website that is on screen there. But also, with your permission, we'll be contacting you through email with the links that are featured today so that you get a swifter access direct to some of the things that we've been talking about. I'm mindful that we haven't had a whole stream of Q&A there, but thank you very much for the questions that have come in, and please bring some more questions. We'll be very interested in your thoughts about this presentation, about what you've heard, further questions and queries, and we'd be very pleased to come back to you. Thank you very much for being part of this, and wish you all the best for the coming season. So, goodbye.